The Transforming Canadian Healthcare Through Innovation conference series is very important because we have in Canada many good ideas, many good proposals, good policies, good activities taking place in the provinces and in the territories, but we're not very good at bringing those ideas together, to scaling them up and to pursuing common objectives. I think the conference structure itself is characteristic of our view that multiple stakeholders and different agents of change are required in moving things in Canada forward. One of the challenges that we have in the Canadian agenda with respect to healthcare change is that many of the different agents of change, if you will, are seen to have a particular interest. Our conference, or our approach to the conference, was to bring together senior people in business and academia and government and in the healthcare sector, broadly construed, in an environment where they could talk to each other. The advantage that a university has, and Queen's in particular, is that it is a venue for open discussion and debate. So it's creating the climate and the environment that makes political change possible.
When you look at all the levels in a very complex system that have to say yes to the widespread adoption of some of these things, that is the great opportunity to get people from the disparate pieces of the overall healthcare system and start to have the conversations. You know, when I talk about disruptive innovation and the democratization of healthcare, what we're really talking about is the transformation of Canadian healthcare through innovation. So if you look at where the power's been, you know, you had to go to a doctor's office, you had to go to the hospital, you had to be referred to a specialist. Those rules are being broken wide open.
I'd say the innovation agenda in Canada is front of mind. It's certainly front of mind both at the provincial level and at the national level. We have to invest strongly in emerging innovations in health technologies. You know, the potential there is pretty dramatic. This whole area of patient engagement is going to radically alter the way we deliver healthcare and will include basically working in partnership with our patients who will become the co-owner of their own health. A large part of why these conferences have been so energizing is because they've adopted almost as a fundamental principle that we need to look at this from a multidisciplinary approach. We've had the good fortune over the last few years of being able to bring really interesting people together, people from different perspectives. We've had CEOs of our hospitals, we've had deputy ministers from government, we've had CEOs from industry, and we've had international leaders in the area of healthcare policy.
No one part of society owns the solution to this. Governments alone can't solve these problems. In my experience, when you bring thought leaders together from different disciplines and different jurisdictions and give them time and space to collaborate, they will, and you get better ideas and real opportunities to change things, and they will feed off each other and drive much better outcomes than anyone could deliver in isolation, and that's just what this opportunity is.